Hi, and welcome to the Chapter 8 slides. This chapter goes over a few different fields, a couple of fields that are very relevant to public health: exposure science, industrial hygiene, and it talks about exposure assessment. So the two main fields that this chapter talks about are industrial hygiene and exposure science. So industrial hygiene is really mostly relevant to the workplace. When I think of an industrial hygienist, I think about someone who is contracted by a big company or works at a big company, and the person's job is to really keep the workers in that company safe. Industrial hygienists can be somewhat restricted by the federal regulations that they have to follow. So there are federal regulations for allowable levels of chemicals and other things that can be present in workplaces, and sometimes those aren't based on the most recent science. In contrast to that, you can look at exposure scientists, and exposure scientists also want to understand what people are being exposed to, but their methods are a little bit different, and usually their objective is quite different. So most exposure scientists that I know are working in academia in the research setting. But it is important to understand that both of these fields do try to quantify exposures, and they really do this. They use some of the same techniques, and they do have some of the same goals. So first we're going to talk about the industrial hygienist, and we're going to go through the steps that an industrial hygienist would take to evaluate exposures to a particular chemical in a workplace. So first, the exposure hygienist would go through a step that's called anticipation. So this is where the hygienist gets information about what activities take place at the site. If it's someone who already works at the company, then the industrial hygienist probably already has all the information about the particular types of hazards, including chemical storage, and other hazards that could be present. If it's a contractor coming in, they would have a lot more to do in the anticipation step. The next step is the recognition phase, and this is the site visit or the walkthrough where the industrial hygienist really goes through and takes a visual assessment of exactly what's happening and how these chemicals are being used. And they can identify which particular activities are most likely to result in an exposure that's going to be of concern. The next step is the evaluation, and this is where the industrial hygienist really tries to quantify the exposure to the workers. And they can do this in a few different, they can use a few different techniques to do this. They can sample in a room, or they can do a personal sampling. Personal sampling is where you have a monitor that is really a little recording device almost that is in the breathing zone of a person who's actually breathing in those chemicals. And the industrial hygienist could also use biomarkers, which we'll talk about more in a little bit. But biomarkers are proof that a chemical has gotten inside of someone's body. This is usually blood or urine. And there's a few different ways that the industrial hygienist can decide who to sample. If you have a company with 50,000 workers, it's probably not very convenient to sample all those 50,000 workers. So there's several different ways that you can select from your population of workers who you want to sample. One way is you can stratify workers. You can group them into activities or types of activities that are most likely to be common, and then pick a representative sample from those groups. You can also ask for volunteers who want to participate in a monitoring. This can be biased because you might have the people with the most concerns or the most complaints volunteering. You can also pick your worst case scenario. And then for the instruments, you do have some direct reading instruments. These are things like thermometers, and for the most part, you'll be using some kind of sample collection instrument. And the next slide talks about some of the different sample collection instruments that are used. And there's two main types that are discussed. There's active and there's passive sampling. So active sampling is an air pump that draws air in and moves quite a large volume of air through the pump over a certain period of time. And this active sampling has advantages over the more passive sampling devices because it can pull in more air, and then the chemical that you're monitoring for will absorb to whatever media you have in the pump. But the more air you pull in, the more sensitive your analysis will be. So the active measurements are usually preferred for monitoring low-level exposures. The passive sampling instruments just work by diffusion, so you're really limited by the amount of air and the amount of chemical that can diffuse through your system. So one thing that the industrial hygienist is going to focus on once they've done all these steps is they want to focus on some type of control, because the job of the industrial hygienist is to keep the workers safe and to keep their exposures hopefully below what will cause any health effects. And there's a few different ways that industrial hygienists can recommend controls. The best one is substitution, where you simply say, well, instead of using a very toxic chemical, let's use something that's less toxic. That can be a very good idea. Sometimes there's a phrase that's called regrettable substitutions. This is when substitutions are made, a very toxic chemical is taken out, and then a chemical that is thought to be less toxic is put in. However, we're seeing more and more often that these chemicals that were thought to be less toxic when they were put into place, several years ago, often turn out to be just as toxic as the one they replaced. Some other good methods for controlling are isolation, and this is really a physical engineering solution to limit access to some hazardous materials. You can also use ventilation. That's a very good idea if you have things that are gases, that are volatile. You can also have administrative controls. These are automatic checks that prevent people from spending too long in a particular activity that can cause risk. You can have protective devices, things that physically require some sort of check before they can be used to reduce hazards. The least effective is the personal protective equipment, and these are things like gloves, goggles, boots. And the reason why they're not as protective as these other methods is that you really have to have the people using them. And oftentimes the personal protective equipment, the PPE, is too easy for people to just forget or not put on properly, and then exposures can result. So there are a few terms that are very important both to the industrial hygienist and the exposure scientist. These are concentration, exposure, and dose. And these are three different terms. The concentration refers to the amount of chemical in the air. And you can express it as a mass of chemical per volume air. And you see the units there in microgram per cubic meter of air. You can also express it on a volume per volume basis. This is what we see very often with gases. You see things expressed as parts per billion. You can convert between these mass per volume and volume per volume ratios as long as you know the molecular weight of the chemical. So the exposure is really how the chemical comes into contact with your body. So if you're wearing long sleeves and a mask and a hat, then there could be no exposure to a chemical. But if you wear short sleeves and there's a chemical in the air, you could have exposure to your skin. So the exposure is just how much is touching a surface of your body. And then the last concept is dose. And the dose is the amount of the chemical or the contaminant that gets inside your body. Even if something touches your skin, such as a chemical, it could be absorbed very well, but oftentimes the skin provides a very good barrier to prevent absorption from certain types of chemicals. So the dose is going to really be dependent on the concentration of the chemical and the exposure duration, and then the rate at which the chemical gets into your body. And that's going to be specific for every chemical. That's called an absorption factor. So if only 20% of a chemical is absorbed, then your absorption factor would be 0.2. If 80% of a chemical is absorbed through a given pathway, then your absorption factor would be 0.8. So now we'll talk a little bit about the other career path, exposure science. And this really focuses on how people are exposed. It focuses both on the exposure route, inhalation, ingestion, or dermal exposure. This is something we discussed in Chapter 6. And it also looks at the exposure pathway. So is it coming in through the food? Is it through the drinking water? Is it through the soil? Is it through consumer products? The exposure scientist also considers the frequency, intensity, and duration of the exposure. These can all have effects on how much a person absorbs into their body. So if someone's exposed to a very high concentration of a chemical for a very short period of time, they may not be able to absorb it all and they may have a very low dose. But if someone is exposed to a much lower concentration of a chemical for a longer period of time, they may end up with a higher internal dose. There are also important questions to ask, such as the peak concentration, how frequently people are exposed, and during what time period they are exposed. So if the critical effect, if the adverse effect is a developmental effect that you would only see in pregnant women, then you would be looking at exposure during a very short window of time to a very specific group of people. And then in the bottom, it talks about 3 different exposure scenarios that are often used by EPA and often used in risk assessment. The first one is acute exposure. And this is really what you think of. So when you're exposed to a chemical, you're really asking, how is a person going to feel within 24 hours? Are they going to be nauseous, vomiting? Are they going to stop breathing? Are they going to die? Once you move off from acute exposure scenarios, the opposite end of the spectrum is the chronic exposure. So what happens to a person if they're exposed for at least 10% of their lifetime, which is considered 7 years? What kind of chronic health effects will be seen? These often include things like cancer or liver damage. In between those, you have subchronic exposure. And that really means it's quite a wide range, but it means exposure that is greater than 30 days, but less than 7 years. So there are a few different exposure assessment methods that exposure scientists can use. Some of these are very cheap and easy to do, and some of these are much more expensive. So probably the cheapest and easiest thing to do is to do some sort of modeling. And this is an indirect exposure assessment. So for example, if you want to study a population of people and you want to study a contaminant in their drinking water, you could assume they're all drinking the same type of water, measure the contaminant in their public drinking water, and assume everyone drinks the same amount. It is a crude measurement, but again, it is very cheap and easy to do. You can also do a direct measurement, which of course is much more expensive because now you're measuring individual people's exposure. The best thing to do is to use biomarkers. Biomarkers they can be adducts of blood or adducts that are found in your urine. It's when a chemical is attached to something in your body, a fluid, and that fluid can be taken out and the chemical can be measured. So again, common fluids that are measured from the body are urine, blood, and breast milk. And the last concept that's discussed is aggregate and cumulative exposure. Aggregate exposure really refers to thinking about exposure not only from one particular pathway, but from all potential pathways. So for example, a chemical in drinking water, you would want to think about, is that chemical also in consumer products? Is it also in your soil? Is it also in your air? That's relatively easy to do in risk assessment. The next concept, which is cumulative exposure assessment, is very difficult to do in risk assessment because the cumulative exposure assessment asks you to assess exposure to all chemicals that have the same mode of action. So for example, if you were trying to assess exposure to all chemicals that are carcinogens, you would have a list of hundreds of thousands of chemicals that we would be exposed to, and it would be a nightmare of an equation. So I hope you've enjoyed this lecture, and I look forward to more of the discussion and talking more about industrial hygiene and exposure science. Thanks a lot.